I talk a lot about insulin on this page, and one of my followers asked me, what is insulin? What is insulin resistance? So today I wanted to take a more, focused dive on this important topic. So if you're struggling with belly fat and low energy or weaker erectile function, it could be insulin resistance that is the hidden, or rather the root cause of this, which is affecting your prostate. Secondarily, it's affecting your testosterone levels and bedroom performance. Secondarily, the root cause. It's always important to get to the root cause when you're doing healing. Okay, so insulin. Insulin is a hormone. It's produced by your pancreas, and its job is to move glucose from your blood into your cells for energy. But with insulin resistance, your cells don't respond to the insulin. So your body, your pancreas is forced to pump more insulin out to try to keep your blood sugar, your blood glucose levels stable. You're putting in more carbs and more sugar, and it's trying to essentially pump it out. So over time, this leads to, inflammation, chronic inflammation, weight gain, and hormonal imbalances. Too much insulin leads to chronic inflammation, which also enlarges your prostate. And so that can cause higher risk for prostate cancer, enlarged prostate. High insulin levels, can also raise your estrogen levels in a man. We don't want too much estrogen, right? Just a little bit, just a little bit. So if your blood sugar is out of control, then that's also an indication that your circulation is also out of control, because insulin resistance damages your blood flow, your blood vessels, blocking blood flow to the most important parts that you want it to go to: capillaries, arteries, and veins. And if that wasn't bad enough, it also lowers your testosterone levels. So lower testosterone means lower libido, lower desire. It's not all in your mind. It's hormones. It's hormones that allow you to respond when you see an attractive, partner, male, female, right? It's hormones that does that. So the good news is you can reverse this and take back, your health and stabilize your insulin. But it's food. You got to cut out processed carbs, sugar, white rice, bread, soda. You got to eat more protein and healthy fats, avocados, eggs, walnuts. You got to exercise, especially after meals. Do squats. I love the squats. Intermittent fasting. Fasting helps to reset your insulin levels. Fast for 12 to 16 hours. And when you fix your insulin resistance, then now your body can reset itself. Your hormones can reset. Your prostate can go back, to more of its natural size and functionality. And you'll feel a lot stronger, a lot better. You won't have those fall-offs, food coma, as I call it, after you eat, right? As you balance out your insulin levels. And then not because you're overworking your pancreas. Your pancreas is the insulin factory, right? So share this with someone that think you needs to hear this, and follow me for more health tips.